So I'm obsessed with finding ways to make pain go away. And as a doctor, the first rule is to do no harm. So today I'm going to show you 3 techniques to help you fix back pain here in the low back, the QL muscle, without triggering your pain. The technique involves moving the rib cage above, the hips below, and learning how to use your obliques. Then at the end of the video, I'm going to show you how to use that all together. But all you're going to need today is a stack of towels. I have 2 bath towels, beach towels. Nice thick towels are the best. And you're going to need to find space on the ground. All right, bring it down here. What you're going to do, the idea is to not hurt the back, not trigger your pain. So we need to learn how to move the ribs above or the hips below. And then of course the abs on the opposite. So these are all opposing things to your back. So your back needs opposition, otherwise it feels like it feels. So if you could learn to move your ribs, or you could learn to move your hips, or you could learn to use your abs, you would stop overworking your back. This is the basic idea, basic transformative idea. So what we're gonna do, and again, we have to do that all without triggering anything. So get you a set of towels, and then you're gonna lay on your stomach. And those towels are gonna be right at the front of your hip. You should feel that front bone, it's the ASIS. And you're gonna make sure you feel that on both sides of your hip. Then you're also going to feel your pubic bone, you know, the very bottom of your hips, that bone there. You wanna make contact with the towels. You want to be able to push the front of your left hip down, and then the front of your right hip down, and then the pubic bone down. So this is giving you a little bit more control over your pelvis. So push the front right, and then also push the front left, and then push the pubic bone down into it. If you push gently, you'll begin to feel like your lower abs, like below your belly button down into your pubic symphysis. You'll begin to feel those abs work. So you want to, if you kind of let your back arch forward, most likely you'll start to trigger your back pain. So what you need to do is put that back into a better position, and by pushing those 3 places, either the front of the right, the front of the left, or the pubic bone. So keep pressure really in the pubic bone, and then a little more left or a little more right, so you get into a position where you do not feel your back pain. You're gonna feel pressure in the front of your hips and not pressure in your back. That's the idea. We wanna shift pressure to the front of the hips by pushing the front of the left, front of the right, or that base. Got it? So that is the easiest one. And once you have found a stable position there, like really pushing down my pubic bone really creates some stable pressure in the front of my hips, I'm just gonna breathe. And if you have created that base at the pelvis, when you breathe in, you should feel air kind of going into your upper back, okay? So we're not gonna let our upper back sink down. That's the second technique I'm gonna show you in just a second. But you're gonna start by creating a stable base and pressure almost in the front of your head. To stay back here on my toes as well. Sometimes if you go down, it tends to overarch your back. So stay there and find pressure in the hips to keep pressure in the hips. Okay, now that you've kept pressure in your hips, you're gonna move to the rib cage. So we're gonna start to move just your chest up and back and down and away. And usually when you go forward like this is where people will start to feel the pain. But you want to really go forward in the chest rather than going down and forward in the lumbar spine. Does that make sense? So you're gonna push your hips down and then move your chest forward without also arching your back. And you're just gonna move back and forth. Sometimes it's helpful to push your elbows down so you can see that is moving my ribs up and down. But then once you have moved to kind of the limit, then you can also move the ribs on their own just a little bit. You see that? So then we'll go down, really push the rib cage forward, and then all the way up. And all the while I'm keeping pressure in my hips. So we're gonna go all the way down and all the way up. Pressure in the hips, really moving just that thoracic spine. You can adjust the position of your arms to kind of change it. I like this wide posture. And I also would suggest that you pull your arms inwards towards each other. So you're pushing your hips down, you're pulling your arms in towards each other, and then as you're pulling your elbows in almost towards your belly button, the line of that belly button, hips down, elbows towards your belly button. Then you're gonna lift your torso up
and down. And then you can add in a little bit of neck movement because they work together. Back and forth. So keeping stable in the hips. And then I'm just moving this rib cage back and forth. And then when I go up, you can pause and take a couple deep breaths. And out. All the while pulling your elbows in, all the while pushing your hips down. Up and down. And up and down. Now, once you do that and you've created pressure in the front of your hips and then pressure in your shoulders and movement in the rib cage, it should begin to offset the strain in your low back because you're learning to create stability below in the hips and mobility above in the thoracic spine. That is one strategy to cause transformation in the low back without triggering it, without doing any harm. Now, you're going to need to do that until you feel confident with it. As you do this, you'll go through the stages of transformation, the 4 stages of transformation, where you go from unconscious incompetence, where you don't know what you don't know. And then as you do this exercise, you will become conscious of your incompetences. You'll become conscious of the various problems, like you don't know how to push your hips forward and down into the thing. It's really hard for you to push down your pubic bone, or if you do push down your pubic bone, it feels nice. There's a nice stability, and you're getting stability in your lower abs and your pelvic floor. Or perhaps you realize you really shrug your shoulders up when you're going back and forth. So you become aware of these incompetences, these insults to the body, as people call them. And then you're able to make changes. So once you become conscious of them, then you are aware of them and you start to make them, you start to become competent at those places you were incompetent. And then finally, once you can maintain all of this, once you become unconsciously competent, where you can basically do this in your sleep. This is different for me. This is new for me. However, this new thing that I'm learning helps take pressure off of my back and put pressure onto my hips. It teaches my hips in the front to hold pressure rather than pressure constantly going into the back. And the same thing with the rib cage. It might feel a little weird to like move your ribs. You might feel incompetent, and you will become conscious of that. And if you can keep your hips pressed down and control the movement of your ribs, creating mobility above the lumbar spine, so your lumbar spine doesn't move too much. That's why things hurt. When they move too much and they exceed the capacity for load, your muscles can only bear so much stress. And when they go past that amount of stress that they can take, that's when pain occurs. So the idea is that the back is doing too much. The back cannot take it. So this strategy of do no harm is to create stability in the hips and mobility in the thoracic spine. And then also it's really going to actually help. You should start to feel your abs engage really well, which is opposing your low back. So we're taking strain off the low back, putting on the hips and the core and the rib cage. That's the strategy. I hope that you found it helpful, but I would suggest doing little micro doses of this exercise, if you will, sort of exercise snacks throughout the day. Like I had a patient one time who had shoulder problems, and she hung a pull-up bar in the doorway, and every time she would pass through that doorway, she would do 2 pull-ups, and I said, do not do more than 2 pull-ups every time you pass that. And if you can't pull up, hang for 10 seconds, no more than 10 seconds. And every time you pass through the door, either hang for 10 seconds or do no more than 2 pull-ups. Well, over the course of the week, she got so much stronger because there were just these little tiny exercise snacks, if you will, and her body made leaps and bounds of changes. Anyways, little things done a lot. That's the idea. Just take little snacks, do this exercise, rewatch this video and follow along, but you need to get comfortable at it. I would say try to hold it. If you can feel the movement and feel the breath, try to be in that position for a good 3 minutes. If you can hold that position and feel confident that you're not using your back, that you are in fact stabilizing your hips and moving your thoracic spine and not triggering your back, if you can do that and be in that position for 2 or 3 minutes, you will be strong and healthy, and that health on the ground will hopefully translate to transformation throughout the rest of the day. Best of luck. If you have any questions, comment below, subscribe and like. Next week, I will show you some more techniques. Comment on what we should do a technique to transform pain, because I am obsessed with finding ways to get you out of pain. That's my job. I'm Dr. John Cybulski. Thank you so much for watching. This is Caterpillar Chiropractic. We're turning back pain into butterflies.